Hi all, welcome back to my channel Mind Over Movement. In the last video, we discussed about the clinical manifestations of frozen shoulder, how to diagnose frozen shoulder and what are the possible mechanisms underlying your frozen shoulder. In this video, we will discuss about the different management options available for frozen shoulder. I am Rafi Ahmed, physical therapist specialized in chronic pain management. Management of frozen shoulder should start with education. Education is very important regarding the condition, how it progresses and what to expect from treatment, and reassurance that the condition will get better. The aim is to achieve a pain-free movement as soon as possible. There is no miraculous fix for frozen shoulder as you can come across in the internet. Frozen shoulder gone in 60 seconds or just in one visit. Google says ginger is the best treatment, but what evidence says? In the first phase, where pain is greater than stiffness and the condition is highly irritable and where you are unable to sleep at nights, your GP can put you on non-steroidal anti-inflammatory drugs. But a corticosteroid induction in the first 12 weeks can lead to greater improvement in pain and function. There is no evidence of high-intensity exercises, stretching or any manual therapy has a role to play in the pain-dominant phase. Maybe in the stiff phase it can improve the condition. So avoid stretching, manual therapy in the pain-dominant phase. A 2019 systematic review by Catherine Winslow showed that there is no evidence for the use of electrotherapy, acupuncture, taping or dry needling in the management of frozen shoulder. So in the acute phase, what can be done? Let's see. Here, you have to respect the pain. Unload the joint to reload. Unload the weight of the arm. So this is a ball rolling exercise. You can use it for any acute painful shoulder or acute stage of frozen shoulder or even after surgeries, after getting consent from the surgeon. So to start with, I'm using a Swiss ball. The main thing is I'm unloading the weight of the arm. You can see here, I'm unloading the weight of the arm with the thumb facing forwards. Step forward into flexion. Step forward into flexion. Stepping forward activates the scapular muscles. Recent research shows that stepping forward activates the scapular muscles. You can also turn 45 degrees to the left and do the same movement. So this you are encouraging abduction, abduction in the scapular plane. This exercise can be progressed to using a dumbbell on the opposite hand. Okay, stepping forward and a shoulder press on the opposite side. Your shoulder press on the contralateral side has been shown to improve muscle strength and range of motion on the affected side. Done in the same way, turn 45 degrees to the left and then step forward, then shoulder press. Turn 45 degrees to the left, shoulder press, shoulder press. So gradually you can apply a gentle pressure. You can apply a gentle pressure on the ball and then move. This is the next progression. I'm applying a gentle pressure on the ball and then stepping forward. That's it. So the next progression is I'm using the Swiss ball on the wall. Position the arm in such a way as the thumb is pointing towards you. Step forward and move the arm into elevation. Step forward, move the arm into elevation. You can just turn 45 degrees to the left and step forward. Turn 45 degrees to the left and step forward. The next progression is you can step forward, then shoulder press, Step forward, then shoulder press. Step to the side, 45 degrees, shoulder press. So next is cane exercises. You can use a cane or a broom at your home in this position and move the cane forwards and backwards slowly. You can do up to the limit of pain. Do not exceed the pain. Any pain less than 30% or 3 in the VAS scale is okay. As a progression, you can move the cane little far away. Move your body along with the arm. This can improve the range in your shoulder. Stretch to the limit of pain and then get back. Do not push heavily. Stretch into the limit of pain and then get back. Another exercise is you can use a Thera loop and then move your body and move your body forwards and backwards. Move your body forwards and backwards. Thera loop activates the posterior cuff muscles. In case of severe pain, when you cannot move the arm away from the body, you can move the body away from the arm. Once next progression of this exercise is using a Thera loop on the wall. Step forward, move the arm into elevation. Stepping forward activates the scapula muscles once again, and this Thera loop activates the posterior cuff muscles. When the posterior cuff muscles are activated, the opposite group of muscles can relax. The next is shoulder sling exercise. For this, I am using a heavy Thera tube on the opposite shoulder and the affected arm in the sling. Push down the Thera tube from the shoulder and then perform a gentle abduction movement. Then push the Thera tube from the shoulder and then step forward and do a outward rotation. Step forward, do a outward rotation. Apart from these exercises, you can do your daily activities respecting pain. A 2017 study by Pallavi Rawat has shown that strengthening in the early painful phase can be beneficial in improving pain, function and range of movement. The next progression is isotonic exercises. So for this, use a Thera tube. Use a small towel to please keep your elbow close to the body and then do a outward movement, pulling the Thera band for external rotation. Slowly move out and in, out and in. For internal rotation, isotonic exercises, pull the Thera tube in and then slowly out. Start from the neutral position, pull in and out. Pull in and out slowly. Pull in and out. Always use a towel to keep the elbow attached to the body. The next is pendula exercises. For this, I am using a small dumbbell of about 2 to 3 kg weight. Step forward and from this position, leave your shoulders completely relaxed. Take a deep breath, then your shoulders
completely relaxed, shift your body weight forwards and backwards and allow the arm to swing completely in a pendular fashion like this. The most common mistake is keeping the arm straight and then moving the arm forwards and backwards. We are not going to strengthen the muscle as such. We are focusing on the mobility of the shoulder joint. So keep your shoulders relaxed so that the arm is moving in a pendular fashion. Now from this position, side to side movements can be performed, shifting the body from left to right, allowing us. Please be reminded the shoulders are completely relaxed and feel the dumbbell is putting a distraction force on your shoulder joint. Then do a circular movement. Once again, shifting the body weight from side to side. This. And now in the opposite direction. You can do this movements. A minute or two, and then repeat the whole circuit again.
In the acute painful phase, corticosteroid injections has a better effect on pain, movement and function than lidocaine alone, which is the analgesic. So injection into the glenohumeral joint and the subacromial space in the early stage, evaluating the risk and benefits, can be beneficial than the glenohumeral injections alone. It is hypothesized that the injection decreases the myofibroblast, thus stopping the progression of contraction of the capsule. So injection should be done in the painful phase, and it is of no use in the stiff phase because the contraction has actually happened. Hydrodistension. This is a method of treatment where sterile saline or a local anesthetic is injected into the shoulder joint. Recent research does not support the hydrodistension. A 30 ml of injection of lidocaine or saline cannot do anything to stretch the capsule. Coming to the stiffness phase. Here the stiffness is more and the pain reduces, as we know. Here joint mobilization and capsular stretching techniques can be applied. 3 new studies deemed to be of low risk of bias in the current review support the use of manual therapy and stretching in the more stiff phase than the painful phase. A range of different joint mobilization techniques have been proposed in the literature for the treatment to regain range of motion in different studies. Let us have a look at these techniques.
This exercise, I have tied my arm close to the body so that this prevents the scapular movement and the movement takes place only in the glenohumeral joint. So with the arm by the side, push your arm gently into external rotation with the opposite hand and then come back. Gently push your arm to the limit of pain. Is a pain of 30% is acceptable, then back. The next is sustained stretching exercises for rotation movements in the shoulder. For this, I'm using a weight and then let the shoulder move into rotation with the weights till I feel a gentle stretch and a pain of 30% is acceptable. So I'm just holding this position for about 10 minutes to the maximum. I can do 3 sets. You may also use a pillow here to just support the arm if it is painful. So to improve internal rotation, I am in the side lying position. See to that the elbows are at 90 degrees to the arm, and then let the arm move down with the weights. Feel a gentle stretch in the shoulder joint and hold this position for about 10 minutes, not allowing pain more than 30% or 3 in the VAS scale and perform 3 sets. Breathe in and breathe out. Next exercise is to improve hand behind back. People with frozen shoulder often have difficulty in reaching the hand behind back. Some people can reach up to here and some can reach up to here. For this exercise, I'm using a TheraTube. So grab the TheraTube in this position and then stretch it down. Hold for 5 seconds. It's better to use a metronome. 1, 2, 3, 4, 5. And then relax. Now I feel that there is not enough tension in the band. So what I do is I just increase the tension in the band, just pulling the band in the forward with the opposite hand. And now performing the same exercise with increased tension. 1, 2, 3, 4, 5, and then up. Now I want to increase the tension once again. Yes, 1, 2, 3, 4, 5, and then up, a slow eccentric contraction. Hold for 5 seconds and then a slow eccentric contraction. So after performing the exercise here 5 or 6 times, just check the change in the range of movement. If you find an immediate increase in the range of movement, then this is because of the muscle stiffness and nothing to do with the capsular pattern. But what we are doing here in this techniques, are we stretching the capsule as proposed in this techniques? Actually, the forces applied during the shoulder mobilization may vary between 3 to 14 kg. A Japanese researcher, Itoi, found that the forces required to stretch the posterior joint capsule is 683 kg per centimeter squared. But the heaviest deadlift is 501 kg according to the 2020 world record is still not enough to stretch the capsule. So what I mean is the heaviest deadlift is still not enough to stretch the capsule. So most of the frozen shoulder contraction syndrome may be due to muscle inhibition or muscle guarding, as the capsule could not be stretched at all. So what we are doing in this techniques is that we are decreasing the muscle guarding through stretching, mobilization and our exercising. Professor Jeremy advocates a graduated exercise program with a safe starting point. Especially in the painful phase, you can start with simple isometrics and proceed to eccentric and then to a technique called heavy slow resistance. This study is under trial by Rafi et al. And we are working on this technique for the past 6 months. A few studies are also under trial regarding the use of virtual reality for frozen shoulder. So recovery takes a long time, and do not forget the psychosocial aspects, which are very important. The psychological aspects like your stress, depression, anxiety, fear about the condition, and your family, friends, workplace, how they are going to respond to your pain. All those things influence your recovery. So what are the surgical options available for this condition? The 2020 UK FROST trial, which is the largest clinical trial, compared early structured physical therapy, manipulation under anesthesia, and arthroscopic capsular release. All these 3 treatment options led to substantial improvement in pain, function, and none of the treatments were clearly superior to other. So now it is up to you to decide to go for exercise, manipulation under anesthesia, or surgery. Happy thawing! To know more about pain neuroscience education and chronic pain management, subscribe this channel, Mind Over Movement. Thank you.